Welcome to Simple Local Life, everyone. It's Jen, and today I am here in Bridgewater at the Earth Angels Home Care Office, and we are carrying on our caregiving talk series with Earth Angels. And I'm really glad and happy to have Tamara Ballard back with us today. How are you, Tamara?
I'm fine, thank you, Jen.
Good.
It's nice to be back.
It is. It's not snowing today.
No, rain.
It's raining.
Yeah.
A lot.
Yes.
But that's okay. It's April,
Yes,
and April
spring is
showers,
here.
May flowers.
Yeah.
Let's just go with that.
Yeah.
So today we're kind of touching on a topic that I think a lot of people might be interested in. And if you have any questions while we're live about living with someone with dementia or having a loved one with dementia, by all means feel free to ask during the video, and if we can't answer them, Tamara would be glad to call you or message you after the video and give you some more information, or even just to have a chat.
Absolutely.
That's helpful, I think, sometimes. So today, one of those questions that we hear a lot about with family and loved ones is dealing with difficult situations. So if your loved one is still at home and living with dementia or Alzheimer's, or if they are even in a nursing home and you're going to visit them, sometimes there can be topics or things that come up that feel really challenging with family members to deal with.
Yes, and often one we always hear is, even when the client is home, they're always asking or saying, I want to go home, I want to go home, I want to go home.
Right.
And so the proper way to approach dealing with this is, first we have to validate the fact that they're distressed, they want to go home, and we have to remember which part of the brain this is coming from. So if you make a fist like this, and you can say this is the limbic system of your brain. So this is where your deepest, most memorable moments are in your brain. And so if you think of that like a layer of an onion, like an onion. So in the core of that onion is your most deepest memories from your childhood, and as you peel off the layers of that onion, those are your most recent memories. So and that's kind of what's happening to the core of your brain, the limbic system. So your memories are kind of like peeling away, and then there's that layering of space and time that's in the core of the brain as well. So yours and my layer in the brain of the cortex is the limbic system is clearly separated. So you can picture the house you grew up in, and you're living here now. Yes. So somebody living with dementia, these two layers kind of get melted together, merged together. So even though they're in their home they've been living in for the last 50 years, they're now picturing the home in that deepest core of their memory. So they're saying, I want to go home, I want to go home. They're not recognizing their surroundings. So the way to approach that is to validate their concerns. So, I would say to you, you want to go home, right? So I would validate that with you. And you would say, yes, I want to go home. And I would continue to validate that by saying, you want to go home. Yes, I want to go home. And then I could slip right into a hand under hand and say, your home must have been very lovely. Can you tell me a bit about your home? And that will kind of get their mind on their home versus the repetitiveness of, I want to go home, I want to go home.
Okay. Well, you can see how challenging this is for loved ones if they are at home and they keep repeating that. And, I think a lot of times people they're patient. It's hard to kind of keep answering that same question, especially when it's so obvious, saying, you are home. But that little example that Tamara gave with that hand-over-hand technique is just so powerful, and just gives you sort of, like you said, kind of redirecting them with thinking about something else, or thinking about their home in a different way, I guess, or describing it. Can they often describe it then?
They can often describe it. They can go right back to the place where they grew up in. Because again, if you go to the limbic system, that core of the onion or the core of the brain, that's your most your memories from the childhood growing up, right? So as you peel away the most recent memories, you're going back to those core memories that are there, and those are the ones that are held on to the longest.
Okay, well that makes sense.
It's also time awareness.
Awareness.
Yeah, so it's that space and time awareness as well.
So. Space and time. So that's a really good example of something you could try yourself with a loved one, is just sort of that validation. And I think too that seems so important, I think, when you're just those words and how you're expressing or communicating back with someone with dementia.
Absolutely.
Okay, good. So So we know that's a common one.
That
I
is
want to
a
go
common one,
home.
yes.
What other kind of common difficult situations, I guess, do you guys see a lot of with your clients and that you guys do?
Very good question. So often people living with dementia will put their most precious valuables away somewhere, like their purse. They'll put their purse away because they don't want anybody to get it.
Yes.
And then of course they'll forget where they put it. And often that part of the brain again will say, they don't realize there's something, they have the broken brain.
Right.
They don't realize they put it somewhere, so they forgot again.
Right.
And so they start accusing people of taking the purse. So, again, if somebody is in the home saying, I put my purse here, it was here, I know somebody come in here and stole it.
Right.
Again, you can validate them.
Yes.
First, you want to mirror their emotion that they're displaying.
Okay.
So, if they're sad, you want to be sad. If they're happy, you want to be happy. If they're angry, show that you validate that anger. So, say, you lost your purse. That must be horrible, versus you put your purse away somewhere, So it's again validating and matching their emotion.
Okay.
Right.
Now,
so,
I wouldn't have thought of that. I would have thought if they were angry that you would stay calm and try to stay calm.
Well, TIPA teaches us that we stay they're at their level.
Yeah.
So if they're up here, we want to be just an octane below their level.
Okay.
Right. So if you were very angry and you were stewing angry and I come up to you and said, "Oh, Jen, no, don't get angry," you'd want to pop me, right?
Yes, that makes sense. Yes. Well, not quite like that, but no, I'm very reasonable. But no, that would be more aggravating, I guess.
Absolutely.
Or kind of get you more worked up.
Absolutely.
Or upset.
Yeah.
Okay,
So again, it's important to match their emotion and validate what they're asking you or looking for. I'm looking for my purse. Somebody must have come in here and stole it. And you could say, oh, that would be an awful thing to happen. I don't like that. I don't like that your purse is stolen. We should just go and see what we can do about that.
Okay.
And you would get more,
more engagement, I guess, and more distraction, I guess, from the actual, my purse has been stolen into, what can we do, or what, is that what you're trying to do?
Yes.
You're trying to get them just, I guess, moved off of that one piece?
Yeah, well, it's not even moving. It's validating. Yep, your purse is missing.
Validating.
Yep, you're validating the purse is missing. We know it's not stolen, but we're not going to change their mind that it's not stolen, right? So we just validate and look for the purse until we find it, right? Yeah.
It makes so much sense when it's explained like this. And again, not something I think is our automatic response sometimes when dealing in these situations. But even just all of us, when you are upset about something, I was thinking you do just want to be validated that someone hears what you're saying.
Absolutely.
So it's really such a common sense approach to it, but something I think that probably takes a lot of practice and
a lot of skill and a lot of practice.
A lot of practice, especially if some of you are dealing. I know a lot of people deal with this in their home, and that's where Earth Angels Home Care comes in, of course, with their caregivers to assist. But it can be pretty challenging and exhausting, and it's a 24/7 type situation for some people in their homes. So these are just such helpful tips. So.
Absolutely, and TIPA always says it takes a team to work with somebody living with dementia, because these repetitive behaviors that happen consistently really wear on the caregiver quite. So you have to be able to tap out and say, okay, Jen, I need to take a breather. I need to step back. Can you step in?
Yes.
And kind of thing. So.
Oh, it makes sense. And we've talked about this before, but all your caregivers are, of course, trained in that TIPA SNOW method, and so that's kind of the approach they have, obviously, when dealing with your clients.
Yes. It's often, and if you get yourself into a situation where somebody is, your loved one is accusing you of stealing their purse or taking something, it's important that you step back. Take a step back, take a time out, do that deep breathing to get your cortisol level down, so that you don't have tunnel vision, so that you can help work with this person living with dementia. Okay, well that's important too for all of you who are, even if you have some help from a caregiver, you're still probably dealing with a lot of it yourself. So recognizing when you need help, and then just knowing kind of, even if and you followed all the if you've been trained or followed it all, it still can be challenging. It can be very challenging. People don't realize, so if you see somebody with a broken arm or a broken leg, you see the cast.
Yeah.
You know, you see the sling.
It's obvious.
Everybody runs to open the door for
Yes,
them or
yes.
do whatever they can when they see the disability. With somebody living with dementia, you don't see the broken brain, so you're looking at the person as if they were always the same way, but not understanding that the brain is broken inside. They're not doing this on purpose.
No.
You know, this is they're doing the best they can with the skills they have left. So we have to help them and support them.
So you just mentioned a second ago, and I know so what would be your advice then? Because I know the one example you gave was, you know, you're coming in with your loved one and they said, oh, my purse is stolen, has been stolen. What if they are accusing you, the caregiver or the loved one, of stealing it themselves? Like, is it the same? So what are you saying to them, I guess, in that instance, if they accuse you of, and not maybe stealing, but something along those lines? What can you talk us through that kind of example?
So
Same sort of philosophy, but
same sort of philosophy. So I've often gone into a home where the caregivers are in the home, and you know, they've called and they said, you know, we're looking for the purse, the missing purse, you know, and so, you know, I'd go down into the home and the caregiver would be searching every closet, and the client living with dementia would be muttering and saying, you know, they were in here, there were 3 of them in here yesterday and they stole my purse, and I would validate her and say, yes, that's not very nice of them. That is awful. Let's see if we can find another purse. You know, I need you. I know you have your hair appointment today. How dare people just come into your house and take your purse? And so you're really validating them. You're not calling them wrong. You're not saying, you know, oh, don't be silly. You're kind of validating them. In the same token, you're looking for that lost purse. And we always eventually find it. And when we bring it out, we say, oh, look, we found your purse. They must have returned it, so you're still validating that person.
There it is, of course, yes.
Yep.
Okay.
Yeah.
Any other difficult situations you see a lot of family members deal with or caregivers on a regular basis? I know those are kind of those are kind of a lot that you see, but anything else?
So it's the repetitiveness, you know, that goes on, and again, it's that part of the brain that's affected. You know, so again, it doesn't matter how many times they repeat themselves. It's again to validate them, because they don't know their brain is broken. So it's, you know, just to support them. You know, we always say, don't focus on what's lost.
Right.
Let's build on the skills they have remaining. So
that's really important and really powerful. I know it can be so challenging and so you know, kind of hard for loved ones to watch their family members kind of go through this and travel on this journey when they do have Alzheimer's or dementia. But it certainly, with the right kind of, like you said, with training and the right language around it is so important.
It's so important, yes.
And I think we've talked about that several times, but I just think it can't be said enough, and I think that's really one of the pivotal parts in dealing with your clients and when family members are dealing with loved ones is that kind of language and just the way you respond when these type of difficult situations come up.
Yes, and we just did a free dementia education workshop last Thursday, which was very well received.
Wonderful.
So we started with 2 take-home key messages, you know, and because it's a lot, and you're not going to learn it all in one day. So just taking home 2 key take-home messages really supported those people that came to the workshop. They were over the moon excited and can't wait for the next workshop.
Oh,
so,
wonderful!
Yeah.
So you guys are planning to do these then as a regular occurrence then?
Yes.
Oh, well, that's great. So great for I know we do our little videos, but so great to be able to attend a workshop with Earth Angels Home Care and get that kind of information firsthand, or to ask any questions. So again, if people have any questions, they can call the Bridgewater office here. I see the number; it just popped right up. Perfect timing. Yeah. What's the number, Tamara?
It's 902-530-6205 in Bridgewater, or 902-893-3553 in Truro.
Oh my, good job. Or stop in any time and make an appointment if you have some issues or questions that you would like to discuss with Tamara or anyone at the Earth Angels Home Care office. If you're struggling with a loved one, or have some questions about how to deal with these difficult situations, or just about what kind of services that they offer here, I know that they're more than happy to talk and have a discussion about how to help you through that.
Absolutely.
Well, thank you so much, Tamara. This was
welcome.
really helpful again. And again, if you guys have any questions, questions, feel free to ask them below or send them along, and we'll be sure to get those answered for you.
And next time, bring the sunshine.
I will try. We need some nice weather on the days I'm here.
Yes, we do.
Anyway, thank you guys so much for watching, and we'll see you next time.
Thank you.
Bye-bye.
Yep.